Okay, so today we're going deep on something I think we've all thought about at some point. Like what happens when a doctor, you know, makes a mistake.
Yeah.
And we've got some sources here that lay out a pretty specific scenario. Like imagine you're a junior doctor, right?
Right.
And you find a medication error in a patient's chart.
Oh, wow.
So then the big question is what do you do next?
It's a huge dilemma ethically in medicine.
Yeah.
And a lot of these sources that we're looking at, they really emphasize this feeling of a pressure cooker in a hospital.
Right.
Everything's happening so fast,
Yeah.
the stakes are high, and you just don't have a lot of time to sit and think about it.
Right. And to make it even trickier, the patient seems okay right now.
Right.
But there is this chance of complications down the line.
Uh-huh.
So then it's like, okay, do you tell the patient about the mistake, even if it might stress them out?
Yeah.
Or do you just not say anything and hope for the best?
It's a tough one. Well, first off, I think we need to touch upon this concept of informed consent.
Right.
And this is really like a cornerstone principle in medicine. And basically what it boils down to is that patients have a right to know about their medical condition, and then they have a right to make decisions about their treatment.
Right.
But they can't really do that if they don't have all the information.
Right. So then in this situation that we're talking about, wouldn't keeping quiet, wouldn't that kind of go against the whole idea of informed consent?
Yeah, I mean,
Because they don't even know that there was a mistake, so how could they make an informed decision?
that's exactly it, and that's where it gets really complicated.
Yeah.
The sources we're looking at point out that the senior doctor, in this case, they actually advise against saying anything at all unless the patient starts getting worse, So their thinking seems to be all about not stressing the patient out too much, anxiety, all of that, because it could actually affect how well they recover. So it's this weird balance, right?
Yeah.
Like potential harm from the medication error, but then also potential harm from the stress of finding out about it.
Right. So you're weighing these two things against each other.
Exactly.
Yeah.
Yeah.
I mean, I can just imagine, put yourself in the shoes of that junior doctor. I mean, talk about being caught in the middle,
Oh, yeah.
right? So let's say, what if they do choose to just not say anything? What could happen?
Well, I mean, obviously, ethically, there's some issues there. You're withholding information.
Right.
But then there's also the legal side of things, too. Like, let's say down the line, those complications we were talking about, they do happen.
Yeah.
The patient might have a legitimate case legally, right?
Right.
To say, hey, I wasn't given all the info. I couldn't make informed choices about my own health.
Exactly.
So that's a whole other can of worms.
And then on top of that, I mean, think about what's going on in the mind of that junior doctor,
Absolutely.
right? Keeping that secret.
Yeah.
The guilt, the fear of what might happen. That's got to be a lot to carry around.
Huge burden.
Yeah. And some of these sources talk about support systems for, people in healthcare, like confidential counseling or support groups with other doctors.
Yeah.
Do you think that would even help in a situation like this?
Totally. I mean, having that safe space to just process all these emotions and actually get advice from people who've been there before, I mean, that's crucial. Ideally, you want hospitals to have really clear rules in place for dealing with medical errors.
Right.
And these rules, they shouldn't just be about protecting the patient, which is obviously important, but they should also be about taking care of the doctors and nurses, the whole team.
Yeah.
Making sure everyone is okay.
So having these clear protocols, it's almost like it gives that junior doctor an out.
Yes.
Right? They know, okay, there's a system. This is how we deal with this. It's not going to be like this big, punishment. Yeah. And that might actually make it a little easier to just do the right thing and tell the patient what's going on.
Yeah, for sure.
Right.
And, I think this whole situation, even though it's all about medicine, it brings up some really important questions that apply to, any job where people can make mistakes.
That's true, yeah.
How do we be transparent, take responsibility for actions, but also make sure we're not harming people unnecessarily?
Right.
Whether it's physically or emotionally, it's tricky.
It's finding that balance.
Yeah.
Right.
Exactly.
Yeah, it's something to really think about in your own field. Like, do you guys have a system for dealing with mistakes openly and honestly?
Yeah.
And if not, could you step up and help make that happen?
That's a good point.
Right. So we've covered a ton in this deep dive. Informed consent, the legal side of things, the ethical side of things, the importance of having a support system.
Right.
But before we wrap up, I know you had one final thought you wanted to leave everyone with.
I do. And it's kind of a big question, but here it is. how can we, as a whole society, create an environment where people feel safe admitting their mistakes, so that everyone can learn from those mistakes and hopefully prevent bad things from happening again down the line?
That's a great question and one worth really thinking about. So thanks for joining us today for this deep dive into the complicated world of medical ethics.
Thanks for having me.
And we'll catch you in the next one.